What are the non-technical skills? Well, we can describe the non-technical skill as the cognitive, social, and personal resource skills that complement technical skills and contribute to safe and efficient task performance. Surgical disciplines, including urology, of course, acknowledge that technical skill expertise alone is insufficient to ensure safe and effective care. And besides, the integration of non-technical skills in urology become increasingly crucial, particularly with the growing impact of technology on outcomes. In the operating room, urologists depend on effective communication not only with their team but also with patients. Clear and empathetic communication, situational awareness, and decision-making enable urologists to adapt to unforeseen challenges and make informed choices for optimal patient care. And non-technical skills in surgery can be broadly categorized into several domains, each encompassing specific abilities crucial for surgical practice. To better explain what non-technical skills are, we could use the non-technical skill for surgeon (NOTS) system, which is a behavioral rating system developed by a multidisciplinary group comprising surgeons, psychologists, and anesthetists in Scotland. The NOTS system delineates the main observable non-technical skills associated with good surgical practice. The NOTS skills are divided into 4 categories, further expanded into elements. Finally, to enhance understanding of the behavior necessary for good performance, the NOTS system provides a series of good and poor practices that distinguish them. Let's keep a look at this non-technical skill in NOTS. Let's talk about situational awareness. Situational awareness refers to the ability to perceive, understand, and predict critical elements of the surrounding environment at a given moment and in a specific context. In the surgical context, this means being constantly aware of what is happening in the operating room and anticipating possible future developments. In the NOTS system, situational awareness is divided into 3 elements. Gather information, which is actively observing the operating environment, monitoring patient parameters, checking equipment and instruments. Understanding information, which is interpreting collected data, recognize and understanding the meaning of information in the context of the intervention. And finally, projection and anticipating, thinking ahead about possible complications or changes, predicting future needs during the intervention. These elements of NOTS emphasizes the importance of maintaining a comprehensive awareness of the surgical environment, patient status, and possible and potential future developments. It requires continuous attention and integration of information from various sources, including visual observation, team communication, patient monitors, and prior experience. Let's talk now about decision-making. Decision-making refers to the process of selecting a course of action among various possible alternatives. In the surgical context, this involves making informed and timely decisions based on the assessment of the situation, considering risk and benefits of the patient. In the NOTS system, decision-making is divided into 4 main elements, which is considering options, generating several possible solutions, evaluating the pros and cons of each option, then selecting and communicating the option, which is choosing the most appropriate course of action, clearly communicating the decision to the team, then implementing and reviewing the decision, putting the chosen decision into action, monitoring the effectiveness of the decision and modifying if necessary. Finally, considering risk and benefits, assessing the potential risk associated with each option, balancing risk and with potential benefits for the patient. These elements of NOTS underscores the critical nature of making timely, well-informed decisions in the dynamic surgical environment. It highlights the importance of considering multiple options, evaluating risk and benefits, and being prepared to adapt the decision as circumstances change. Effective decision-making involves not only the lead surgeon, but also incorporates input from the entire surgical team when appropriate. Talk now about communication and teamwork, which is the skill necessary for the effective interaction and collaboration within the surgical team. It encompasses the exchange of information, ideas, and concern to ensure a shared understanding and coordinated effort during a surgical procedure. In the NOT system, communication and teamwork is divided into three main elements. That's exchanging of information, which is providing clear and timely updates to the team, listening actively and acknowledging information for the team members, ensuring critical information is shared and understood by all. Establishing a shared understanding, which is confirming team members' understanding of the situation, discussing planned procedure and potential issues, encouraging input and questions from all team members, and then coordinating team activities, which is clearly defining roles and responsibility, supporting others and offering help when needed, and finally addressing conflicts or disagreements constructively. Effective communication and teamwork in surgery helps to reduce error and misunderstanding, improve patient safety and surgical outcomes, enhance team efficiency and performance, and create a positive and supportive work environment. This element of notes emphasizes the importance of clear, open, and respectful communication among all members of the surgical team, from surgeon to anesthesiologists to nurses and technicians. Finally, let's talk about leadership. Leadership in surgery refers to the ability to guide and support the team effectively, ensuring optimal performance and patient care. It involves setting direction, motivating team members, and managing resources efficiently throughout the surgical procedure. In the NOT system, leadership is divided into three main elements, which is setting and maintaining standards, clearly communicating expectations for safety performance, leading by example and demonstrating professional behavior, and showing adherence to protocols and best practices. Then supporting others, providing guidance and constructive feedback to team members, encouraging and valuing input from all team members, recognizing and addressing signs of fatigue or stress in the team, and finally coping with pressure, which is maintaining calm and focus during challenging situations, making decisions confidently under the time pressure, and adapting leadership style to suit the situation and team needs. Effective leadership in surgery helps to create a positive team culture and work environment, enhance team performance and efficiency, improve patient safety and surgical outcomes, and foster professional development within the team. This element of notes emphasize the importance of the surgeon's role not just as a technical aspect, but as a team leader who can effectively manage both the task-related and interpersonal aspect of surgical care. In conclusion, the interplay between safety, performance, technical and non-technical skills is absolutely critical. Sectors like aviation and urology demanding high performance underscore the pivotal role of non-technical skills, including situational awareness, communication, teamwork, and leadership. Prioritizing attention to non-technical skills is essential to ensure optimal performance, emphasizing the importance alongside technical skills, especially in critical settings like the operating room. The acknowledgement that non-technical skills are as vital as technical skills in professions related to safety, particularly in the operating room, is a cornerstone in fostering a culture of excellence and safety. Thank you.